Hello everyone. So in this session, I am going to talk about brachial plexus, a very important topic for your upper limb session. Okay, so we'll cover this topic in brief and I will again take a class in which we will have a detailed lecture of brachial plexus. Okay, so if I talk about the brachial plexus, it is a group of nerves, bunch of nerves, which is giving innervation to the structures of upper limb. How the brachial plexus are formed? So the brachial plexus are formed by the ventral rami of C5, C6, C7, C8 and T1. So this is the usual formation of brachial plexus, but sometimes we have got the prefixed brachial plexus in which the contribution is taken from C4 cervical nerve also. If the contribution is taken from T2 and this leads to the formation of brachial plexus, such kind of brachial plexus are called as post-fixed brachial plexus. Now, if I talk about the brachial plexus, the brachial plexus is having 5 components. It is having roots, trunks, division, and it is having the cords and branches. Okay, so these are 5 components of brachial plexus. So I would like to tell you about these components, how it is formed, and then we will talk about the branches of brachial plexus. So it is having roots, trunks, division, cords, and then comes the branches. Okay, so these are 5 components of brachial plexus which you have to understand. Okay, now the roots of brachial plexus, as I told you, it is formed from the ventral rami of C5, C6, C7, C8 and T1. Okay, so this part is the root of brachial plexus. This is the root of brachial plexus. Now, C5 and C6 will join to form the upper trunk. So this is C5 and this is C6. This will join to form the upper trunk. So this is UT for the upper trunk. C7 alone will form the middle trunk and C8 and T1 will join to form the lower trunk. Okay. So this part is the trunks of brachial plexus. Okay. Now, the branches of individual component of brachial plexus I will describe afterwards. Let me first tell you how the brachial plexus are formed. Okay. Now, after that, each of the trunks of brachial plexus, each of the trunk of brachial plexus divides into anterior and posterior division. The division component of brachial plexus is located behind the clavicle. So here, I would like to mark here that each of these trunks will divide and form. So this is A for the anterior division and here P stands for the posterior division. Okay. Now, in this diagram, what you can appreciate the anterior division of. So this is the anterior division. The anterior division of upper and middle trunk will join and lead to the formation of lateral cord. So which cord is this? This is the lateral cord. The posterior division, if I talk about the posterior division of all the 3 trunks, the posterior or dorsal division of all the 3 trunks, upper, middle and the lower, will lead to the formation of posterior cord of brachial plexus. So this is posterior cord. Okay. Now, the anterior division of the lower trunk will alone lead to the formation of medial cord of brachial plexus. So this is medial cord of brachial plexus. So this is how the cords of brachial plexus are formed. And after that, we will also discuss about the branches. So this is how the cords of brachial plexus are formed. Okay. Now, let's discuss about the branches of individual component of brachial plexus. So from the root, 2 major branches are given from the brachial plexus. One is dorsal scapular nerve This is DS for the dorsal scapular nerve, and this is the another nerve, that is LTN, that is long thoracic nerve. So the two branches which is given from the root are dorsal scapular nerve and long thoracic nerve. So here, if you want to write, please write down dorsal scapular nerve. LTN stands for long thoracic nerve. Now here, the long thoracic, if I talk about the long thoracic nerve, so if I talk about the long thoracic nerve, it should be important for you to understand that long thoracic nerve is also called as the Bell's nerve. So yes, long thoracic nerve is also called as the Bell's nerve. Okay. So we have done with the full form. I'm just rubbing it because I want to write the other branches too. Okay. Now, dorsal scapular nerve, which is DS, is having the root value C5, and this dorsal scapular nerve is giving innervation to the dorsal medial attachment onto the scapular medial border. So on the dorsal aspect of the medial border, there is levator scapulae, rhomboides major and rhomboides minor muscle, which get innervation from dorsal scapular nerve. If I talk about LTN nerve, that is long thoracic nerve, which is also called as Bell's nerve or the nerve to serratus anterior, it is giving innervation to serratus anterior muscle. When this nerve is injured, the patient will have winging of scapula. Now coming to the upper trunk, which is formed by joining C5 and C6. So in the trunks, we know that three trunks are there, the upper, the middle and the lower trunk. So there is no branches from the middle trunk and there is no branches from the lower trunk. So there are two branches from the upper trunk, that is suprascapular nerve and nerve to subclavius. So we have got two branches from the upper trunk, NS and SS. Okay, so here NS stands for nerve to subclavius, which is a small muscle in the subclavian group of the, which is a small muscle in the clavicle inferior aspect, and the other one is suprascapular nerve. Both these nerves has the root value C5 and C6. Okay. And as I already told you, the middle and the lower trunk is not giving any branches. Now, division. From the division part of the brachial plexus, which is located behind the clavicle, no branches are given, neither from the anterior division nor from the posterior division. There are branches from the lateral cord, posterior cord and medial cord. So this is very important, and we will discuss all the branches from the cords of brachial plexus. For this, I will give you a mnemonic. So let's talk about the branches from the lateral cord. So branches from the lateral cord. If I talk about branches from the lateral cord, the mnemonic is medial leaf 2. ML2, medial leaf 2. So here M stands for, musculocutaneous nerve. Another L stands for LPN. What is LPN? Lateral pectoral nerve. So LPN means lateral pectoral nerve. LPN means lateral pectoral nerve. And it also gives the lateral root of medial nerve. So this is the lateral root of medial nerve. Actually, medial nerve is the thickest branch of brachial plexus, which is formed by taking contribution from the two roots. The lateral part of medial nerve is formed as a branch from the lateral cord. And if I talk about the medial root of medial nerve, it is formed from the medial cord of brachial plexus. So if you want, we can state the branches of the lateral cord. So this is the lateral cord, which is formed from the anterior division of upper and middle trunk, and this lateral cord is giving three branches. Okay, so this is musculocutaneous nerve, this is the lateral root of medial nerve, and this one is the lateral pectoral nerve. Okay, now let's talk about the branches. So next is to know the branches of the posterior cord. So if I talk about the branches of the posterior cord, the mnemonic is rats. Rats in the upper and that of lower self. S for self. So rats in the upper and lower self. So here R, this is R for radial nerve. This is A for axillary nerve. T for thoracodorsal nerve. this is T for thoracodorsal nerve, and this is upper and the lower subscapular, upper and the lower subscapular. So once more, I would like to tell the branches from the posterior cords can be memorized by rats in the upper self and the lower self. R here stands for radial nerve, A for axillary nerve, T for thoracodorsal nerve, and US and LS we can say for upper and the lower subscapular nerve. Okay, so we have done the posterior cord also. What remains is the medial cord. So if I talk about the medial cord, so if I am talking about the medial cord branches can be memorized by the mnemonic me for you. So medial cord branches can be me for you, that means M4 and U. M4 and U. Okay, so let's see the branches of the medial cord of brachial plexus. So for this, I am using another color. So let's highlight firstly the branches of the posterior cord. So as we know, the posterior cord is formed by taking contribution from the posterior division of all the three trunks. This leads to the formation of posterior cord, as you can see. And these are all branches of the posterior cord, which has been highlighted with red color. Okay, now branches from the medial cord. So medial cord is formed from anterior division of the lower trunk, and these are all the branches from the medial cord. So as I told you, the mnemonic for the branches of the medial cord will be M for you, me for you. So here, this is medial root. This is the medial root of medial nerve. Okay, this is the ulnar nerve. This is the ulnar nerve. Okay, this is the ulnar nerve. Okay, this is the ulnar nerve. So I will just write UN for the ulnar nerve. Got it? This is the ulnar nerve. Now, this is medial cutaneous nerve of arm, and this is medial cutaneous nerve of forearm. So this is medial cutaneous nerve of forearm, and this is medial cutaneous nerve of arm. Okay, this is medial cutaneous nerve of arm, and this is medial cutaneous nerve of forearm. And this nerve is MPN. What is MPN? Medial pectoral nerve. Okay, so the branches. So very easy to remember the branches. So if I talk about the branches of the medial cord is M for you, me for you. 4 M's are there. So if I talk about the 4 M's, in this 4 M's, we have already seen M stands for the medial root of medial nerve, another M for medial cutaneous nerve of arm and medial cutaneous nerve of forearm, medial pectoral nerve, and U stands for ulnar nerve. So this is how we can memorize the branches of all the cords of brachial plexus. The cords of brachial plexus is located in the axilla, and this location is below the level of clavicle. So branches from the cords of brachial plexus will be infraclavicular branches of brachial plexus, and the branches from the roots and the upper trunk of brachial plexus will be the supraclavicular branch of brachial plexus. Thank you. All the best.